Now in this video, I'm going to tell you about how to access our Kerala PSC online course. Now, if you see our NEET MDS course and Kerala PSC course, you will see that there is a small difference in the interface. So as a result, it's worth explaining to you how exactly the Kerala PSC course works. Okay, if you open your package, you'll see 4 course contents in your Kerala PSC course. One is your schedule and notification. Second is your new content update. Third is your archive section. And fourth is additional contents. I'll explain to you each. Okay. Now schedule and notification are very easy to understand. There is nothing big. It's the entire schedule where and how our entire course is going to progress, okay, based on when exactly the exam is. So if the exam is till September, we'll have to finish it before September. If it is in November, so that's the updates given so far, September to November. So if it is on September, we'll cover the entire portions once, and we'll also revise possibly twice, so 3 times coverage. If it happens after September, we'll have time to cover it once again. So that's how the entire the schedule is being planned. You can go through it in detail. Now, if you come back to the next part, which is the new content update. Now, here you have to understand the course is divided into 2 parts. One is the mandatory content, the must-do content. Now, why this type of design? 2 parts. One is a mandatory and second is optional or additional. You can see additional contents here. Now, as we know that most of the PSC exam candidates are either working in the clinics or practicing or maybe doing their PGs. So in different phases where they're little busy out there. Okay. So unlike the NEET MDS candidates where most of the serious candidates, okay, most of the serious candidates are full-time learning and fully dedicated learning, I would say. So in that case, we can go in depth and there is nothing to omit. And second reason definitely is that the PSC syllabus is much less vast, or I would say NEET MDS syllabus is much more vast than your Kerala PSC syllabus and exam pattern. So 2 parts. One is the first part, that is the new content update and archive section. These 2 contents are related and this is additional. Okay, now what is the relationship between new content update and the archive section? New content every day, if you see, I'll show you the schedule. Every day based on the schedule, you will get updates on the new content update section. The next day, when new content is added for the next day, the previous content will be added to the archive section. Okay, so I'll show you how. So this is your new content update section. You'll see different contents added today. This is day 1 of anatomy, where you have the schedule of anatomy. So I think it's worth explaining this as well if people haven't understood. I've explained this in the group, but yes, this is the first subject we are going to start based on the schedule. And you can see 2 charts here. One is this chart and next is this chart. So the first chart explains to you where exactly the questions, okay, below are the list of chapters and topics from which questions has been asked in previous Kerala PSC exam. So this is it, okay, from which are the topics, which are the areas where questions has been asked. So based on that, we have designed a schedule of 2 weeks where we'll go into little details. Okay, so day 1 schedule is basically triangles of head and neck. To understand triangles of head and neck, you have to understand the deep cervical fascia and muscles. Okay, so we'll be first going deep cervical fascia, then we'll go into muscles, then only we'll go into a triangle. So there is a small mismatch here. This should have come up. Okay, so muscles of head and neck. So today the content uploaded is anatomy schedule first, then you have the lectures on deep cervical fascia. 2 lectures are there, so it's worth understanding. Okay, there is not additional contents because this is something a little depth is required. And then, okay, before that, where exactly the question has come? Triangles of head and neck. One is carotid fascia, so it comes under carotid deep cervical fascias, and then a little bit on carotid triangle. Now, when you're learning about carotid fascia, it's better to understand other fascias also. Okay. And definitely you're going to come across space infections and everything. So it's worth understanding these area. Okay. to understand things better later on. So that's the reason you have 2 lectures on deep cervical fascia, and then you have got notes on deep cervical fascia. Actually, you have notes for more than deep cervical fascia. Just download it and keep it with you. So it's better. Okay, it contains notes on deep cervical fascia, muscles of head and neck, and anterior triangle. Now, this is the area where you get the questions on deep cervical fascia. Again, not into too much of depth like your NEET MDS. You've just gone peripherally. What is required for your Kerala PSC? You can simply start. Okay, it will give you some instructions and right away. Yes, this is the area where questions has come. So you can just do save and next. Okay, save and next, go to the next questions. So I think I'll just go back. Okay, so this is the new content update. Now tomorrow, this entire content will be removed and we'll add it in the archive section. So you will see, so before you start, just see what it is. It's the same thing. In this section, all the content specific to Kerala PSC exam will be arranged subject wise. So this is the subject wise in the exactly ABCD order, alphabetical order, so that you can search any subject at one particular time. So if you want to see which are the exact order of subjects, you can see here. Okay, because as more and more contents get updated, you will have a little problem because it will go deeper and deeper down. Okay, but now tomorrow you will see under anatomy. It's not there today because it's the day 1. Under anatomy, you will see all these previous contents being uploaded here, there, and this will be removed and new content will come there. So don't worry, you will not miss the previous content. It will be there here. Okay, so I hope it's understood. Now, there's the next section, that is archive we understood, additional content. Again, the same thing. Now just read this. This section contains extra course materials related to Kerala PSC Assistant Dental Surgeon, again organized in subject-wise manner. While these topics may not constitute the core or most high-yield contents, or not the most important, additional insights and extra edge. Okay, but you should be done with your daily updates and archive section before coming on to this. Again, it's an order. Now, a typical example, anterior triangle is important. Posterior triangle, I would say it's additional. So, posterior triangle will come here. Now, don't worry, don't think that what will happen if I don't know new contents are updated. Don't worry. Once you purchase the course, you will get an in-app notification every time a new content is added. So, they'll tell you new content added under additional content section, and there will be a name also, example posterior triangle. So that's how the content will get updated. So one thing is every day keep an update on your notification. Every day keep checking this. Now this is why the new section is or this new content update section is important, because whenever a new content is added, you don't need to search where the content is, just come here. Only thing is you have to keep up to date with things. So I hope it's clear. Okay. Now if any student wants to know where exactly to buy this course, just go to the store or simply search dentalamazeacademy.in. You will come to our website. Okay, this is our website. You just go to courses. You'll see buy courses. So you have different courses here, mainly focused on NEET MDS, but this is the course which is Assistant Dental Surgeon. Just click on that, come down, buy now. Okay, and if you have any problem, you have got WhatsApp, I can click on that if you have any query. Okay, other than that, you can proceed, just simply click proceed. If you have a promo code, you can apply that. Okay, and you can choose any payment method, UPI, card, wallet, net banking, pay later, EMI. So all these are payment gateway options you have. Okay, if your card supports any of this, you can proceed with that. Okay, let me check what the offers are. Okay, there are some offers given. So this is all payment gateway offers. If any one of this you apply, it applies to you, you can apply them. Okay, so thank you so much. Have a wonderful day and take care.